Welcome to this week's Smilecast. Today we thought we'd talk a little bit about the most interesting subject of gum disease. Yeah, you might be asking yourself, really, I hear people talking about gum disease, but what is it? And what we have learned is that we realize that gum disease is actually caused by a plaque, which is basically a buildup of bacteria. And these bacteria just naturally live in our mouth, but when we get too much of an accumulation, then they can start to cause problems. The first problem that cause is gingivitis, and you also probably have heard about that. Basically an inflammation of the gums, and that's why sometimes your gums bleed or they can hurt. When healthy gums, they don't bleed or they don't hurt. If that plaque that causes the gingivitis is there long enough, it can get underneath the gum, then it can cause what we call periodontal disease or gum disease, or back in the old days, pyorrhea. You probably heard people that said, oh, I lost my teeth in pyorrhea. Interestingly, gum disease is the #1 reason for tooth loss, because once that plaque gets underneath the gum, it gives off toxins which actually almost dissolve the bone, which is the foundation which is holding your teeth in. So you might be saying, well, maybe I have this, maybe I have some of those signs. What can we do about it? Luckily, dentistry now has ability to take care of a lot of problems with periodontal disease or gum disease. So often now we can actually take like a small probe, put it in the gum area where the site's bad, and then culture that. We can find out what bacteria we're dealing with, and then specifically create a treatment plan that is suited just for you. It's really an exciting field. Our dental hygienists are really up on all this. They are so good at taking care of your specific needs, and that way you don't have to worry about gum disease, and that should make you smile. And as you know, at the Fornetti Dental Center, smiles are what it's all about.